Hello everyone, I'm Rachael Lowe from Physiopedia, and today I am delighted to be talking to Joanne Morris. Hi Jo.
Hi Rachel.
Thanks for joining me today. You have been an author on a book that has recently been published by Elsevier called Pharmacology, Handbook for Physiotherapists, and it's a really good book. I've seen a copy. It's such a great reference book for physiotherapists. I think it's something that we've needed for quite a long time. So today I'd like to talk to you a little bit about pharmacology, sort of what physios need to know, try and get some clinical tips out of you for physios to take into their practice when they're thinking about drugs and medications and working with their patients. But before we do anything else, maybe you could just tell us a little bit about yourself, the kind of work that you get up to, and how you got involved in the book.
Sure, thanks Rachel. So I'm a physio trained in the UK, emigrated to Australia in 2004. Before I came to Australia, I did a Master's in Clinical Biomechanics through the University of Salford. So my practice has been always in musculoskeletal physio since probably 2002, having graduated in 1999. On moving to Australia, I continued that and worked in some private practice and have worked in mainly public health. My work at the moment is in the emergency department as an extended scope physiotherapist and in orthopaedic outpatients here at the Canberra Hospital. And I've done some work. I went back to the UK in 2008 and did an emergency department practitioner's job back in the UK. So certainly my area of expertise is musculoskeletal practice, orthopedics and ED. I'm also doing a PhD at the moment, looking at a cost-benefit analysis, if you like, or an economic analysis of orthopedic triage by physiotherapists. So I'm about a third of the way through that. So I spend 2 days a week doing that and 3 days a week working clinically.
Okay, it sounds like a really interesting career pathway that you've had. And what I really want to ask you all about is your experience in the emergency departments. But I must stay focused, and I think we need to talk about pharmacology. We need to talk about pharmacology today. So tell us a little bit how you got involved in this book.
Well, I worked for about 8 years as a part-time project officer, part-time clinician on an extended scope physiotherapy project here in Canberra. And we did a lot of work planning what that role would look like, what training, credentialing a position like that would need, where was the greatest areas of clinical need for an extended scope physio within our own jurisdiction, but also exploring other jurisdictions for their experiences, and what types of skills these physios might need. So obviously that brought up advanced clinical skills, radiology, and pharmacology was an important component of that. So I did some work with some tertiary institutions here in Australia about what pharmacology education might look like for physios in that more advanced practice role. And certainly the book is targeted not just at advanced practice physios, it's targeted at sort of student physios all the way through to that more expert clinician. But the bulk of my work has been around pharmacology for advanced practice roles. So we developed some competency frameworks for physios working in those roles based on the clinical need within our own areas. So for us, that was the emergency department and orthopaedic outpatients were seen to be the areas we could have the greatest influence on patient care. So the pharmacology work I've done was focused around what a physio might need working in ED and in orthopedics. So I was approached by, I can't even think who it was now, may have been Jackie or Elsevier or somebody initially to provide some input into the concept of a pharmacology book for physios. and they really got my attention, I suppose. Having forayed into sort of education for physios in pharmacology, the thought of being involved in writing a book that would support educations and be a practical support for physios in those areas really interested me. So I managed to persuade them to take me on board as an editor and as an author of some of the chapters, and I feel very honoured to have done that.
Yeah. Okay. So I've got lots of questions going around in my head that I want to ask you. We'll come back to the chapters that you've written in a little bit, but going back to when you talk about creating a sort of clinical competency framework for the physios that are working, and you've done that in relation to sort of an extended scope practitioner in relation to pharmacology.
Yeah.
What I want to ask is, what are those clinical competencies that the extended scope practitioner needs to have, and how are those different from any other practitioner in relation to just a normal physiotherapist in any setting compared to the advanced practitioner? Are they different? Are they the same, those clinical competencies, and do they need to have different sort of sets of knowledge, or is it just sort of an overall the same?
I think that in terms of the core skills that physios have, our great asset is our ability to examine a patient and come up with differential diagnosis. And I think we do that better than a lot of our counterparts, dare I say it. I think the areas where we felt we needed extra competency and extra education were those skills that aren't traditionally done by physio. So in terms of reading x-rays, for example, where we learned that on the job, I think. Certainly I worked as a non-extended scope physio in emergency and learned a lot from my colleagues, but to add some sort of formal process to those skills, like reading x-rays or prescribing pain relief, I think they're the facets of that role that need additional training and additional competency assessments.
Yeah. So the prescribing role is an extended role for physiotherapists, and that requires the training and that's something that's coming in the UK, and I know you're thinking about that training for a prescribing role for physiotherapists in Australia as well. But what about the practitioner who doesn't want to do prescribing, who isn't in the extended role? What kind of knowledge about pharmacology do they need to have?
That's a great question.
And how do they use that knowledge as well? Yeah. So
yeah, that's a great question, and it's certainly something that Australian physio broadly is kind of battling with, if you like, at the moment, or certainly having those discussions. What level is appropriate for a physio prescribing? But as you said, how could a physio who doesn't want to prescribe use pharmacology knowledge? And I think there's lots of areas where thinking about medication needs to become core in the way we think. So at the moment, physios are very good at understanding disease pathology and pathophysiology. Perhaps where we have less knowledge is around what influence medications have on those disease processes. So even for a physio who's not interested in prescribing, to gain an understanding around some of those basic pharmacology concepts, such as the mechanism of action of drugs or side effects or interactions, I think would only enhance the way they treat their patients.
And because I guess those things that you've just mentioned, so mechanisms of interaction and side effects, they will obviously have effects on the patient that could influence our treatment that we're doing with patients.
Absolutely, and that's really, I think, the fundamental basis of the book is that it's there to help people to understand what impact medication might be having on the patient sat in front of them, And I think as physios, we're a group of clinicians that spend a long time with our patients, a lot longer than perhaps some of the prescribing doctors or physicians may spend with patients. We actually have them with us in our rooms for half an hour or an hour. So we gain a lot more insight into potential, as you said, side effects or ways that drugs might be affecting the patients that they don't think of at the time that they're talking to their medical practitioner. So I think if we can have some more knowledge there, we can support our patients better.
So maybe the education that every physiotherapist needs to have is as simple as the fact that they should know that they need to recognise what medications people are on and be able to identify if those medications might be having an effect on the patient. And then we don't need to know exactly what that is, but we need to be able to just quickly go and look that up, or look that up for next time, so that we are so that we are able to then address that, whether it be changing our treatment strategies or communicating with the multidisciplinary team about concerns about medication. Would that be fair to say?
Yeah, I think that's really fair. And I think it will only enhance our ability to manage our patients because certainly in the environments I work, particularly I guess what springs to mind is the emergency department. If you can understand the peak action of a drug, a pain relief for a patient, so you've been asked to, or you're going to apply a back slab or give some exercises to a patient who's got back pain. If you know when that the medication they've been given is at its peak level of action, then you're going to have a much happier patient because they'll be in less pain when you're applying your treatment or whatever that may be.
Yeah. So okay. So we've talked about sort of every physiotherapist and the skills. This has kind of covered skills and competencies that they need to have. It's almost recognising medications, recognising when they might have an effect, and recognising how to integrate that into treatment management strategies. So for those, if we move on to prescribing, for those physiotherapists in the more extended role, and I know you're working on the prescribing situation in Australia, and I know it's a big discussion, but can you tell us just a little bit about thoughts on prescribing, what's happening in Australia, what's happening in the UK, that sort of thing?
Yeah, and it's a huge subject.
Yes.
That has many sort of different facets to it, I suppose. In terms of where we are in Australia at the moment, so pretty much no physios can prescribe, or very few physios can actually prescribe medication. It's all down to the individual sort of state laws around whether you can or can't give any medications, which at this point in time is restricts the practice of prescribing for most physios. For my mind, if, as and when physios are able to prescribe in Australia, and for those physios prescribing in England, I think one of the key messages that I'd like to see out there is how we can use medication in combination with our physio treatments. And as physios, one of the key things I think we can do is consider things around de-prescribing. So patients are often on a huge raft of medications that if we can use some of our physio skills to reduce their need for or dependence on medications and get people functioning in the best way possible on the lowest amount of medication possible, then I see that as a really key role that would be unique to physios in many ways, because we have that ability to combine our physio skills with those prescribing skills.
Okay, that's really interesting, because I think when you think about what we do spend a long time with the patient, and we do see all the medications that they're on, and we can see how they're influencing treatment and how our treatment influences them and how we might be able to, so assessing that situation. And I guess even for a physiotherapist that isn't able to prescribe, it's worth thinking about that as well, because you can always go back to the doctor or the person in charge of prescribing and make suggestions or discuss your thoughts with that person, can't you? So it's a really good role for us to have if we go that way. But it's not necessary. It's for those people that are in extended roles, isn't it? And in the situations where...
Yeah, and I certainly see it as an adjunct to a already fantastic toolbox for physios. It's certainly not the sort of be-all and end-all, if you like. I think it's just a nice way we can complete the patient's journey, if you like, without sort of multiple stops or multiple different contacts the patient has to have. If we can just add that to our skill set, then I just see it as completing the journey.
It's almost as well, it's sort of optimising their health, isn't it, on their journey, as well as optimising our treatments with them or our work with them. So maybe it's about using our knowledge of pharmacology to optimise that journey and their health. That's a really nice way to think about it. Yeah. So in the book, coming back to the book, you wrote several chapters. You wrote you were involved with the orthopaedic and musculoskeletal chapters and the endocrinology chapter. But I'm really interested just to ask you about the chapter that you wrote on legal and ethical issues. For physiotherapists listening to this and interested in pharmacology and learning more, what are the legal and ethical issues that we need to be thinking about?
That's going to vary depending on which country they're in at the time, because obviously every country and in Australia every state has different rules around what physios can do. So I think probably the key message is to gain an understanding of that, of what your legal abilities are to interact with medication. And certainly this was something that I think physio in Australia is only just getting its head around at the moment. I would say 10 years ago that physios here would probably give advice around medication, and perhaps without understanding that even that is tantamount to a prescription. So even just telling a patient that they could perhaps try some ibuprofen, because you're a health professional, that is deemed to be a form of verbal prescription. And I think we're actually only just understanding the legal implications, if you like, of that. So we have, where I work, a very strict criteria around what advice you're allowed to give in terms of medication advice. And it's very much that you could look into this alongside your pharmacist. In terms of how we would advise people around medications. So I think the first thing is to gain that understanding around what your legal position is wherever you happen to be. In terms of how to approach medication, so in Australia there's some work being done around non-medical prescribing and how people anticipate that sort of happening, and there is a stepped sort of approach to prescribing through the quality use of medicines, and that's covered in chapter 1 of the book, and that will give you all of the information that should be included when you give advice around medications. So including sort of the anticipated action of the medication, the name of the medication, the active ingredients in the medication, what people need to know if you're going to give them advice about pharmacology or prescribe something.
I was going to say, I think that's really interesting about there must be quite a lot of physios who offer advice to just generally as part of around anti-inflammatories and pain relief and things like that, because people do in normal life, not just as a physio, but you would to your family and things like that. But like you say, if you're a healthcare professional, then that becomes a concern maybe in your professional practice. And so yeah, your advice to look up your legal status with regards to medication in your own context is really good advice.
Yeah, and I think part of it becomes around knowing what you don't know. There was a study done, I think, in around 2007 that was a question around non-steroidal anti-inflammatories sent to physios in, I think it was New Zealand or Australia, I can't remember quite the details of it. But it was a little bit alarming, the number of physios that didn't actually understand the potential issues with non-steroidal anti-inflammatories, such as asthmatics or people with kidney disease. So I think sometimes it's sort of getting an understanding of knowing what you don't know that's important as well.
Okay, so is there anything else on the legal and ethical side that every physio should be aware of?
Let me think. Nothing else that immediately springs to mind. I mean, there's issues around then education and training, as we've sort of touched on there, and knowing what you don't know, and the legislative requirements, but risk mitigation strategies, I think, as well, are important parts of your ethical obligations when it comes to medications, and understanding what the risks are in terms of what you're advising patients, and understanding what those risks are and how to mitigate against them. Something popped into my head then, and I've just forgotten what it was. Oh, that's right. Continuing professional development, I think, is an important thing that because we're on the start of our journey of prescribing for physios in Australia, we're trying to plan ahead for what might be acceptable in terms of continuing professional development. And obviously there are national requirements under national law for physios who are working clinically, but how does that change if you add pharmacology and prescribing into the mix, which is something, again, as I said, we're sort of looking at the moment.
Good. Well, all really interesting. I think there's quite a lot of things to think about there in relation to, and I guess on the ethical side as well, like you say, it's knowing what you don't know, but also making sure that you do know as well, isn't it? Coming back to what we talk, coming back to the sort of basic level of competency that we talked about, knowing that you need to find out what medications people are on, that you should be able to recognise when you need to look them up to see if they're going to influence your treatment, things like that. So I guess that comes under a sort of ethical kind of heading as well.
Absolutely. And that goes for over-the-counter medications as well. So those things that patients get themselves on independently, and understanding how their prescribed medications might interact with whatever they take that's over-the-counter.
And I guess the other side of that as well is if you have concerns with medications and you're not a prescriber in the UK or wherever, you don't have that legal right to give advice about medications. It's to make sure you have a good relationship with a multidisciplinary team around, isn't it? So that you can find someone who can make the intervention.
Absolutely, and it's then becomes about if you've got a little bit of knowledge, so if you've got some ability to back up your conversations with an evidence-based approach, then you'll only engender that relationship better as well.
Yeah, absolutely. Okay, so some really nice talking to you about the pharmacology and sort of how we should be thinking about our role and our scope of practice. Are there any other messages that you would like to give to physiotherapists around the world about medications, pharmacology, prescribing, anything like that that you think is really important that we need to pay more attention to or learn more about, or anything like that?
I think I jotted a few things down when we were planning this conversation, and I think we've covered a lot of what are the key things, I think. So we've talked about your legal obligations. De-prescription, I think, is a really important role for physios. We've talked about melding our physio skills with any sort of pharmacology knowledge that we have, and I think that's where the book comes in as a great sort of resource around just a quick reference to my patients on this, therefore I could recommend that they do their exercise program 2 hours after they've taken X. And I think having some of that knowledge at your fingertips is really important. I'd like to see in the future physios getting more involved in research that looks at physio modalities with pharmacology or medicines as well, because I think, as we talked about before, there's that really nice marriage of what we offer patients with physiotherapy skills and how we could really bolster that with medications as well. So it'd be good. I mean, I love research, so it'd be really good to see people doing a bit more of that. And I know there's sort of things around, but that's where I'd love to see the future sort of work progress.
Great. Well, I think some really nice summary of what we've talked about, actually. And the book is a nice handbook. It's not a tool for reading right through, as we've talked about. It's a great reference tool to have in a clinical practice to refer to. And I really like your example of, it's not all about prescribing medications, but it's also about how we combine our treatments with medications. And your example of looking something up and realising that, treatment's going to be better 2 hours after they take their medication, or exercises, or their exercise program, or whatever. I think that's a really nice way to reinforce that our pharmacology knowledge is not all about prescribing and what drugs they should and shouldn't be on and changing levels. It's about how we work our treatment into what working with the medications that they're on. So I think that's a really nice message. So we've talked about a lot. Any final messages or anything that we haven't talked about that you'd like to bring up?
I don't think so. I think, as I said, we've probably covered everything that I was thinking of. Yeah, so that's been great to talk to you, and thanks for sort of looking at the book. And I think it's an excellent resource for physios. I'm very proud to have been involved in it.
Oh, well, thank you so much for talking to us, Joanne. Is there anywhere that people can find out more about you online? Are you on Twitter or anything?
I'm on ResearchGate.
ResearchGate. Yes, it does count. Yeah, so we can
Yes.
find you on ResearchGate if you want to find out more about Joanne's work. And the book, Pharmacology Handbook for Physiotherapists, Joanne's work is also in that book. So thanks so much for talking to us, Joanne. It's been really, really insightful. And hopefully we will hear more from you in the future on how prescribing is going in Australia, and maybe more research from physios in relation to medications. So thank you very much.
Thanks, Rachel.